So the thing about diabetic retinopathy is it's a microvascular complication in your eye, and it is a leading cause of visual problems, blindness. And the thing is, it's all over the world. And the other risk factors for the diabetic retinopathy include the long duration of the diabetes, poor glycemic control, and blood pressure issues. That's something other than obesity. Obesity is an add-on factor into that. And the thing is, obesity is associated with all of these: poor glycemic control, poor blood pressure, poor diabetes control, duration of diabetes. The thing is, they are interlinked. So whoever has obesity and has diabetes, they have increased chance of diabetic retinopathy, and therefore they have increased chance of blood pressure and other conditions that I just enlisted. And that's why diabetic retinopathy has more propensity to cause blindness in those obese patients, because the mechanism for the association between obesity and diabetes is very straightforward. What is that? It's the insulin resistance. Insulin resistance, inflammation, and adipose tissue dysfunction are the three basic things that are leading to this whole mechanism of diabetic retinopathy, and that can end up into blindness. So you have to take it seriously. And there was a national survey that found that the prevalence of diabetic retinopathy actually increased with the BMI. So even after adjusting those factors like blood pressure, cholesterol, obesity in itself, the large BMI in itself, was a very strong correlating factor leading to diabetic retinopathy. And we all know by now from my other videos as well that yes, diabetic retinopathy can lead to blindness if it's not addressed. And there was a meta-analysis of 13 prospective cohort studies that found out that obesity was associated with a significant increase in the risk of diabetic retinopathy. It's a significant association, significant correlation. So you need to address your obesity if you have diabetes, regardless of the fact. If you don't have diabetes, you may get diabetes in near future or future, and that can lead to diabetic retinopathy, and diabetic retinopathy leads to blindness. So one thing at a time, you have to address it from day number one. If you're addressing it too late, then it may not help. But again, we have to evaluate your eyes and then address it accordingly. Okay, but taking a step every single day will help. Okay, I hope that helps. Thank you so much. Have a great day. Bye-bye.